Welcome back to the Kolender Medical Radio Show. I'm your host, Anne-Marie Cronin, here talking with Dr. Brian Kolender, board certified in internal medicine and specialist in artery disease, with offices in Bingham Farms and downtown Detroit. Dr. Kolender is here with us discussing his concierge practice and how to avoid heart attack and stroke, and how to begin the reversal of artery disease. Now, Dr. Kolender, we've been talking about diabetes and who's diabetic, and explain a little bit more. Are you talking about after being diagnosed or pre-diagnosis?
So Anne-Marie, this is where it's scary, because you don't need to be diabetic to have insulin resistance, and insulin resistance be the reason you have a heart attack or stroke. So again, if you have a family history of diabetes, you're overweight, you've been told you are pre-diabetic, or you are diabetic, it does not matter what you've been told in terms of your quote-unquote control. If your insulin resistance is not being addressed effectively, you are not stopping the process of inflammation that causes heart attacks or strokes suddenly. So now, the next question I'm going to ask myself and answer is, now what do we do? What do people out there do? And traditional medicine, the system that you're all in, is looking at the risk factors and treating them. We're asking the wrong question. The first question is, do you have disease? So the first question is, do I make plaque? Do I have vascular inflammation? You have to ask that question first, and then go back and root out all the causes of inflammation that are affecting the individual person. None of these things we're talking about can be applied to a population as a whole. We need to look at you on an individual basis, which is again why you need a concierge doctor, whether you call me. Again, I'm an affiliate of MDVIP. You can go on mdvip.com and find another doctor there if I'm not near you, but doesn't mean you're going to have a doctor that's tuned into this as I am, even if you go with another MDVIP doctor. You need someone with the time who knows what to look at, who knows how to interpret what we're doing. But again, the first thing you got to know is, do you have disease? Which means getting a CT calcium score of your heart to know if you made heart plaque.
So everybody should get that. Let's just stop here and ask, should everybody use...
I want my whole practice getting a CAT scan of the heart, because I need to know if they make heart plaque, and I also want everyone in the practice to get what's called a carotid intima media thickness test. And this looks directly at the inflammation of your arteries. So inflammation caused by insulin resistance, among other things, causes the lining of the artery to get thickened and irritated like a pimple. And your plaque that's inside the wall of your artery is like having a sea of pimples if you've got a lot of disease ready to pop. And when they pop, your body wants to heal that damage, and the clot that forms to heal it is blocking your artery, causing sudden death and stroke, which causes sudden disability. I want to segue for a second and address our sponsor, bystanderresponse.com. Doug Reynolds is generous enough to give me the time to talk to you guys and help educate you on heart attack and stroke prevention. And the reason this is a great topic for us is because no one expects to have a heart attack and stroke, and no one expects to be a bystander of an event. And there's so many gun-related incidences out there, and God knows what shootings, and so every one of us can possibly be a bystander and save a life.
Right.
So if you go on his website, you can also access his site through Stop the Bleed, bystanderresponse.com. It's a great site, and it's simple education about what to do if you're in this event and how to save a life. And it's very straightforward, great videos.
And hopefully we'll have him on a future show so
absolutely.
That he can explain all about it to us.
He's a great guy, and he's got a lot to tell us. So we want to save a life that we don't expect a situation to be in, and that's going to educate us. And here, in this show now, we're going to save your life and the lives of your family by
Right.
recognizing that the system you're in, the health system, is not looking at the right things. So back to diabetes and insulin resistance, it's not enough to have a low hemoglobin A1C, which to me should mean that I'm doing a great job of
This
managing.
is a standard test. When you say that, when you
Standard
go to your
test.
primary care physician, this is a test that you'll get from any primary care physician, right?
But a hemoglobin A1C it's not perfect, and it is not good at identifying insulin resistance. There are blood tests that we use, and actually in my practice,
What do you say we use? You mean
so I'm saying myself and some other concierge doctors, I use some blood work that digs much deeper into what's going on metabolically in your body that can ferret out.
See, I think that's really important because the average person out there goes to the average primary care physician. They think that doctor should know all of the tests that you should be able to get because they are basically diagnosticians.
Well, it's not their fault that they don't know. They're stuck in a system that does not
Whose fault is it?
Well, where the doctor could take a role is recognize, hey, I'm not able to do a good job here. I need to step outside the system and do a better job for my patient. And that's
But we're just talking about tests right now. We're just talking about blood
well, you ask
tests.
whose fault it is. So,
Right.
I'm also going to put it on my listeners. Go out there and demand of your doctor to do a better job. If you love your doctor and he's great, but he's stuck in the system and not able to give you the time you need, tell him, hey, why don't you go and be a MD VIP doctor? You're gonna, and because I want you to be this person for me.
Right.
I want you to be Dr. Collin, my Dr.
Well,
Collin.
it's all about time. It's all about spending more than 4 or 5 or 6 minutes, and it's all about seeing your doctor when you're not sick for the purpose of staying well.
And also recognizing that there's more to learn, and that you've got to go above and beyond the call of duty here to be on the cutting edge of prevention. And again, just doesn't matter who you are, you can take this role, but it takes a lot of time with every single patient, and it takes a little detective work on every single patient to find out what their specific root causes are.
Well, I just want to say one thing here, though. Like you mentioned earlier, you're the only practice, or maybe other concierge practices, that do these extended blood tests or extended blood work. Not every doctor is doing these tests.
No, they're not.
And it's simple. A blood test is simple, and a CT scan is simple. I mean, it's like a 1-minute test, and you're saying that everybody who is at risk should be having this test that basically only you give, or very few doctors give.
I'm the only one in the area doing these carotid intima media thickness ultrasounds. So I want to give all my listeners here an opportunity that whether you're in my practice or not, I want you to call my office, 248-737-0091. Kolender Medical. You can look me up, Kolender, Kolender, because no one can spell it properly.
It's not that hard to spell.
Well, no one spelled it right ever. So look me up, call the number, schedule a carotid ultrasound, not a Doppler. We've said it. If you've been told your Doppler's okay, you should not be reassured, because the Doppler does not identify subclinical disease and inflammation. So schedule your CIMT ultrasound and learn what is going on with your arteries. It's not enough to have good cholesterol, good blood pressure, and your diabetic status under control. You need to know what is going on from an inflammatory point of view in your arteries. And then you need someone who knows what to do with the information you're getting.
Right.
It's complicated. Again, just because I'm saying all this is complicated, it doesn't mean it's out of the reach of anybody. It's not, you don't need to mortgage the house to join my practice.
No, but
it's really reasonable.
Right, but the other thing is, I think that we're talking about basically a simple blood test. I mean, it's like a blood draw, and you're the only person that's basically offering this test, and the CT scan itself is very simple.
Right.
And everyone should get it.
Again, but you also need someone that knows what to do with all this stuff.
Somebody's got to be able to take it to the next level.
We'll start you on the path, and come on in, and we'll get that done for you guys.
Okay, well, we're going to have to take a quick break. In the meantime, you're listening to the Kolender Medical Radio Show. You can reach Dr. Brian Kolender by calling 248-737-0091. Again, that number is 248-737-0091. You're listening to the Kolender Medical Radio Show on News Talk 760.